Hello, my name is Curtis Hansel. I am a National Registry Certified EMT. I'm licensed in 2 states, Florida and North Dakota. I also run an ASHE approved training center. ASHE is the American Safety and Health Institute. Through them, I teach a number of health and safety related classes, both locally and online. And I also train on a number of other topics as well, all of which you can explore at my website, www.cjcertified.com. I will be your instructor for today's course, H2S Awareness for the First Responder. Now, I've broken this course into 3 sections. As we go through the course, we'll talk first about the nature of H2S. What is H2S? How do you identify it? Where do you find it? That kind of stuff. Then our second section, we will talk about some precautions for emergency responders. And then lastly, we'll talk about some patient treatment options. Now, at some point during each of these 3 sections, we will take a pause timeout, pause the video. You'll pause the video, and that's where you'll discuss within your group some of the things that we talked about up to that point. Obviously, if you're watching this video alone, you can take that time to pause the video and jot down some notes as far as the things that we've discussed in that section. So with that, we will go ahead and dive into H2S awareness. First off, what is H2S? H2S is a deadly poisonous gas. It is colorless, so you can't see it, but you can smell it. And it has that distinct rotten egg smell that you'll notice if you've worked in places where there's H2S gas at any level for any period of time. You'll recognize it and you'll know it. But kind of a sulfur kind of, if you've been to Yellowstone or hot pots or that kind of thing, you'll recognize it, similar to that. But I would say in my personal experience with H2S gas, it's even more, I got more kick to it, more taste to it, more, I don't know, it's a little more pungent than even the pure sulfur stuff that you smell. Burns a little more. H2S is made up of 1 sulfur and 2 hydrogen atoms. Now when we're talking chemistry, here's a confession. I have a master's degree, and in all my formal education, I have never taken a chemistry class. High school through college, I dodged that bullet. So I don't know chemistry. So when you show me H2S, all I know is that there's 2 H's and 1 S, and that's the extent of the chemistry that you're going to get. So 2 hydrogen, 1 sulfur atom. Now there are some different names for H2S. You'll hear it referred to by different terms. Some of those terms include swamp gas, stink damp, sewer gas, sour gas. If you're in a setting where there's H2S on well sites, a lot of times in the oil and gas industry, when they're drilling a well, or when there's a well present that has H2S gas on it, they'll call that well a sour well. When they call a well a sour well, they're referring to the presence of H2S gas on that well. How is or where is H2S gas formed? Well, H2S gas will form anywhere there is either plant or animal life that is decaying with the lack of oxygen. So anywhere there's plant or animal life decaying with the lack of oxygen, you're going to encounter H2S gas. It's there. So knowing that, this is a good spot for our first pause. So what I want you to do, we're going to pause the video, and I want you to just take a minute and discuss within your group, where are some areas, some locations, or what are some situations in your line of work where you might or would expect to encounter H2S gas, okay? Where are some places or what are some situations in your line of work where you might expect to find H2S gas? Again, if you're watching this by yourself, jot down some notes where you might in your line of work find H2S gas. We'll pause the video and then we'll be right back. Okay, hopefully that was a good discussion. Hopefully you identified some places or situations where you as a first responder might encounter H2S gas. Obvious places, there's a number of industrial sites where that stuff might be present. If you're responding to a shipyard or some other industrial place, or a place where there's tanks or things like that, where people might be welding or repairing or dismantling those kinds of things down inside these tanks, you will certainly run the risk of finding H2S gas there. Oil and gas industry, if you're in an area where there's a lot of oil or gas drilling, you're going to obviously encounter it there. Places like garbage, landfills, those kinds of places, sewer treatment areas. And also we see on occasion people who attempt to take their life using H2S as a way of ending their own life. And so you've got to be aware that that is a situation that anybody might come across at any given time. So what are some of the characteristics of H2S? H2S is more dense than air. H2S has a density factor of 1.19. All that means is that compared to normal air, H2S is 1.19 times as dense as air. So given that it is 1.19 times more dense than air, it is heavier than air, and being heavier than air, it will sink. H2S gas will find the low-lying areas, and so that's where you're going to be more apt to encounter it, and those are more dangerous areas than if you get someplace high. If you can elevate yourself, get above it, you're less likely to encounter it. Also, wind will disperse H2S gas quite rapidly. So wind can be your friend when we're talking H2S gas. It can also be your worst enemy if you're downwind from the stuff. But get upwind and let the wind disperse the H2S gas. It does a good job of it. Now, knowing that there's H2S gas there, it can be detected by the human nose at 1 part per million. Now that's amazing, because you think about one molecule out of a million and your nose will sense it, will smell it. It just gives you an idea of how dangerous, how powerful this gas is. That's really pungent stuff if you can smell it at 1 part per million. Now be aware though, don't rely on your sense of smell to detect H2S gas, because it has a tendency, if you're exposed to it at higher concentrations or even at lower concentrations over a period of time, it can affect your sense of smell. And so you may have an affected nasal olfactory sense of smell because of the gas, and maybe relying on that to detect the gas, and it's not accurately detecting it because of the nature of the gas affecting your nose. So don't rely on H2S, the smell of H2S, to determine whether it's there or not. Now, some other characteristics of H2S gas. It is water soluble, so it can be absorbed by water and then transported by water. Now, some characteristics of the gas: when it mixes with water, it then becomes corrosive. So H2S gas and water is now a corrosive mixture. And that corrosive mixture, that gas, will become more volatile or more unstable if it is shaken or heated up. So you can imagine there are many cases where, for instance, vehicles carrying H2S laden water are loaded. When that tank or truck is loaded with H2S water, there's no detection of it, And so those involved in the transportation assume that what they're hauling is safe, and then as that water is being hauled down the road or through or wherever whatever vehicle it's being taken in, it's being agitated and heated up. Then when they go to offload it, all of a sudden they're in danger, not knowing, thinking they were safe, but not knowing that the agitation has caused the gas to be more volatile, more dangerous. This is an actual picture that you see here off of OSHA's website of a pipe that was carrying H2S water. You can see the corrosive nature of that. Now, when we're dealing with harmful substances, we have some agencies out there which are there to help protect us and give us information as far as how to deal with these substances. One, OSHA has established some exposure limit levels when dealing with H2S gas or any harmful substance for that matter. They let us know what is a safe environment for us to be in, and their exposure limit levels. So for instance, for H2S gas, OSHA tells us that the first exposure limit is called your PEL. It's the permissible exposure limit. All the PEL says, according to OSHA, is that if you're exposed at this level for a period of an average 8-hour work day, you will not suffer permanent health damage. Okay? And for H2S, that is 10 parts per million. So what OSHA is saying is, if that gas is there at 10 parts per million, you could be exposed to that over an 8-hour workday and not suffer permanent health damage. But be careful, be aware. Everybody is different. People's physical makeup and susceptibility to the gas is different. And any exposure at all to this gas poses risks. So just because it doesn't present permanent health damage doesn't mean you won't be affected by that, and we don't know what the long-term health effects of that gas could be. So even at 10 parts per million, if you're working in that environment, expect to have some adverse effects to that gas. Now the next exposure limit is the short-term exposure limit, or STEL. OSHA says that the short-term exposure limit is an environment that we can be in no longer than 15 minutes, or we would expect permanent health damage. So for H2S, that short-term exposure limit is 15 parts per million. So 15 parts per million, you can see we're just bumping up 5 parts per million, and already we're at a short-term exposure limit, which means you don't want to be in that environment any longer than 15 minutes, or you could suffer permanent health damage. And obviously you don't want to be in that environment at all, but serious stuff kicks in if you're exposed for longer than 15 minutes. That's the STEL. And then the third level, or exposure level, that OSHA gives us is the IDLH. That is the immediate danger to life and health. And that is exactly what it says. If you're in that environment, you are posing an immediate danger to your life and health. And for H2S gas, that IDLH limit is 100 parts per million. So again, think about that. 100 parts per million is not a lot when you're talking about air volume. So, and that's deadly. That's deadly. So this is a very powerful poisonous gas that needs to be respected. Now, in addition to the OSHA guidelines, we have some warning labels that are put out by the National Fire Protection Agency, or NFPA. The National Fire Protection Agency gives us this symbol. First, before we get to the symbol, hold on. We have to understand that H2S, in addition to being poisonous, is highly flammable. Highly flammable. As a matter of fact, H2S combusts at a temperature of 500 degrees. Okay? Think about 500 degrees. That's not very hot, but you're combusting at 500 degrees. That's putting bacon in your oven on broil, 500 degrees. So in addition to the poisonous aspects of H2S gas, it is highly flammable as well. Now, back to the NFPA label. The National Fire Protection Agency has given us this label. It's their 704 label. And it's this triangle that you see here. The triangle has 3 colors in it, the blue, the red, and the yellow. All right, each of those sections are different areas of danger that we need to be aware of when we're dealing with this substance, whatever the substance is. And so they will put a number in each of those colored sections, a number between 0 and 4, telling you how dangerous that substance is when on a level of 0 to 4. So 0 would be there's no danger, 4 would be this is as bad as it gets, okay? Now the blue section is our life and health section. In other words, that section tells us how dangerous is this substance if we touch it or breathe it to our health. And there will be a number there, 0 to 4. The red section is your flammability. How combustible is this? How likely is this stuff, dangerous is this stuff if you get it near fire or flame or ignition source? And then the last section, the yellow section, is the stability or the instability. How dangerous is this substance? How stable is it? How dangerous is this substance on a scale of 0 to 4 if you were to shake it or drop it? Stability. And so for H2S, this is what the NFPA 704 label looks like. Now you can see that anytime you've got a substance that hits as bad as it gets, a 4 out of 4 on the dangerous level of the NFPA 704 label, this is something that certainly needs to be respected. 4 as far as health concerns, touching, breathing. 4 as far as combustibility, flammability. 0 in instability, meaning that H2S gas actually is very stable. But keep in mind, only as a gas. Remember when we mix it with water, yeah, it is water soluble, and we learned that if you transport that and agitate it, then it becomes unstable, becomes more potent. So really the label identifies the gas itself, but when we start mixing it with water, we can have a really potent, dangerous situation here when we're talking H2S. So anytime we're dealing with this stuff, we got to have some precautions in place, and you have to have some protocols in place as far as your organization. First and foremost, absolutely most importantly, make sure your scene is safe before you even get out of the vehicle. And I would even add to that, I would make sure that scene is safe before I roll on to location. Because depending on what the situation is, you may get trapped in an environment that you don't want to be in. So be very aware, communicate very clearly, and don't let that adrenaline start rushing and get you all excited to jump out and go rescue somebody when you don't know what that situation is and you don't know if that scene is safe, especially with H2S gas. Do not attempt rescue unless you are properly trained and equipped. Simple as that. Simple as that. Be aware. 25% of H2S deaths, 25% are deaths that occur with emergency responders or rescuers or bystanders. So it's a real serious thing, and you have to be careful as much as your job description says, and as much as you as a human being want to help a person. Don't make that situation worse by adding another victim to the situation. Obviously, become aware of what you're getting into. Read signs. Any industrial location or well site that has the tendency or in a history of H2S gas on that location should have warning signs. So pay attention when you're on the scene or rolling up to the scene. Pay attention to those signs, read the signs, be aware, look around, be aware if there's anything identifying H2S gas there on that location. Also, as far as industrial locations or oil and gas sites, if there's a potential of H2S gas on that site, they should be flying a windsock. There should be an easy to see indication of wind somewhere on that site. So check that out, because knowing the wind direction may help you as far as your approach to that scene. Keeping in mind that upwind is always better when you're dealing with H2S gas, and that wind will disperse that gas. And then check monitor levels, have some way of monitoring those levels, be aware of that, whatever monitor situation you use, or whatever device you use, know how that works, have some protocols as far as being able to assess what those levels are, and obviously have the proper equipment. Anytime you're in any environment that's going to be 50 parts per million or higher, you should be in a full SCBA equipment, full contained mask that is airtight, and where you have been fitted properly to that mask to make sure that it's a positive pressure mask and that there's no gas or air getting into that mask. If you don't have the proper equipment, then wait until that proper equipment arrives, or somebody who is properly trained and has that equipment arrives. So at this point, we're going to take another pause, our section 2 pause. And what I want you to do when you pause the video, let's talk about what are some precautions that you and your organization need to implement. Maybe some protocols. Maybe this is a good time to implement some protocols, or set some goals as far as implementing some protocols. What are some things that you have in place, or that you would like to see in place as far as precautions when you're dealing with these types of calls or situations? So take a minute, talk about that, or however long it takes. We'll pause the video and then we'll be right back. Okay, welcome back. Hopefully that was a good discussion, and hopefully you've talked about some things that you need to have in place for your organization as far as protocols when you're detecting, or when you're dealing with this stuff. What are some things that your organization needs to have in place? Hopefully that's what you have now. Let's talk about the third section, and this section then deals with patient treatment. Now, when we're talking about H2S exposure, inhalation is the primary route of exposure. Cutaneous exposure is not posing a very high risk. It's getting it into your lungs where the danger is. It gets inside, when you breathe it in, it is both an irritant and a chemical asphyxiant. So it affects oxygen utilization at the alveoli level, and it also affects the central nervous system. So you got kind of a double whammy here. Remember, we learned that when H2S mixes with water, it becomes corrosive. So when that gas hits your eyes, when it hits your nose, your mouth, your mucous membranes, all of that, and when it goes into your lungs, the moisture, it's mixing with that moisture, and that's when it becomes corrosive. So then it becomes an irritant. And so be aware of that you've got that irritant effect, and then you've got the effect on your lungs, and then you also have the central nervous effect. So really a lot of things going on here that you have to be aware of, be ready to deal with. Repeated exposure can result in effects that, well, you can be affected by this stuff at lower levels than previously, or other normally healthy people. There have been people that work in this environment, and the longer they work in that environment repeatedly, day after day, they become more susceptible to the effects of H2S even at lower levels than normal healthy people that aren't exposed to it on a regular basis. So again, like we talked about, at lower concentrations, what can you expect? You get that irritation, you get that burning, that throat irritation, the respiratory, the cough, the raspiness, the burning eyes, that kind of thing in your nose and throat. Be very careful. An asthmatic in that situation might have some particular breathing difficulties, and it might aggravate that asthma. Also, these effects can be delayed for hours. Someone can come home from their job, their work, and be at home, and then all of a sudden, it starts building up. This H2S gas seems to have a cumulative effect on us, and that starts building up, and then even when you're no longer in that situation, you could be suffering these symptoms or start to see these symptoms come. You can expect more exacerbated effects, obviously, if you're prolonged exposure. That irritability becomes more intense. Some inflammation, digestive issues, loss of appetite, nausea, that kind of stuff. Moderate levels of exposure, these symptoms just become more severe. So your eyes, ear or nose, the breathing, you may even start to see accumulation of fluid in the lungs. Intense headaches, we see that a lot with H2S patients. People have been exposed to that over a long period of time or at moderate concentration levels. Intense headaches, maybe even some dizziness, nausea, could even have vomiting, could be some elevated mood, aggressiveness, or aggravated nervousness as it attacks the CNS. Now, high concentrations, again, you got to be careful. This person could go into shock, convulsions, may not be able to breathe. Also, you have to be aware of cardiovascular event here. And note that at high concentrations, this stuff is so potent that it takes, a couple of breaths, and even one breath of that stuff could knock a person down. So be very aware of what you're dealing with in these situations and at higher concentrations. Some things to think about when you're dealing with someone who's been exposed to this. There's really, at this point, there's no FDA approved antidote for treating someone with acute hydrogen sulfide poisoning. So really what you're looking at is respiratory and cardiovascular care, monitoring that, high levels of high flow oxygen, be aware of possible intubation may be necessary, and then of course a cardiac arrest is not out of the question. Be prepared for that. I wouldn't advise transporting someone's clothing or other personal belongings that have been exposed to the H2S, just because that stuff can absorb the gas and you get that into an unventilated compartment in an ambulance or other vehicle, and that could affect the emergency responders as well. So don't transport that stuff. Also, anything you can do to make sure that vehicle is well ventilated, then do that, and then obviously get them to a medical facility who's more able to deal with the situation, a higher level of care. Really, that's from an emergency medical standpoint the best thing that we can do. Now, there have been some case studies out there that show some positive reaction to nitrate therapy in the field, but again, that's something that's not been approved, and that's something that you might want to talk to your medical director about, or powers that be, as far as forming your protocols for that kind of in-field treatment. So with that, this is a good place to pause our Section 3 video. Pause the video for Section 3. Pause, and I want you to talk within your group. What are some protocols that your group needs to establish, and maybe take this time to establish some protocols as far as patient treatment and H2S poisoning. So what are some things that you think should be happening with you as an individual or your group or organization when you are treating a person with H2S poisoning? We'll pause and be right back. Okay, good. Hopefully that was a good discussion for you, and you have some of those things in place, and that really brings us to the conclusion of this course and the 3 sections. Hopefully at this point you've learned how to identify H2S, you know what it is, you know where to find it, and you know in your personal or your professional organization where you are most likely to encounter that stuff. Also, you hopefully have established or are aware of the need of some precautions when dealing with this stuff, when responding to emergencies with the possibility of H2S gas exposure. Hopefully now you have or plan on putting some protocols into place as far as precautions to protect you and your team against further victimization of the H2S gas and responding to that scene. And then thirdly, you have hopefully established or set a goal to establish protocols for the treatment of patients with H2S exposure. If you can check those 3 boxes off, then I think our time here together has been well spent. So thank you for your time. Remember, I welcome comments. If you want to leave me a comment below in the comment section below this video, please feel free to do that. And if you have any training needs or have questions about further training for you as an individual or for your group or organization, please hit me up through my website, cjcertified.com, or direct email curtis@cjcertified.com. Thanks for watching, and be safe out there.